Go across to David Johnston. David Johnston.
Thank you, Mr. Speaker. Elderly constituents of mine in Wantage and Didcot have been concerned by media reports suggesting they'll be forced to stay in their homes for an extended period of time. Can my right honourable friend confirm this is in fact not the case, and through all the work he's doing on testing and the tracking and tracing app, that he's working to make sure we can all return to a normal life as soon as possible?
Secretary of State.
Yes, I'd like to take this opportunity, and I'm grateful to my honourable friend for his question, just to set out the exact policy which has been got wrong by a few media outlets in the last few days. We set out from the start, and clearly on the nhs.uk website, that there are broadly three groups of people in terms of the strictures of the social distancing guidelines. There's people of working age who do not have underlying health conditions for whom we must follow the social distancing rules. There are those who are in groups who are, by the science, more susceptible to this disease, including the over 70s and some with underlying health conditions, for whom we say they are clinically vulnerable and must pay particular attention to the social distancing rules. Then there is the group that are shielded. In these cases, these are people who have specific underlying health conditions and will have received a letter from the NHS. It is only this last group that we have said, right from the start of social distancing, that they will need to stay away from people as much as is practically possible for 12 weeks. We know that this is a very significant impact and burden, and hence we've written individually to these people, and in many cases they'll have some specific requirements because of their condition. It's really important that people understand these three separate groups, and I hope that that clears up for the House some of the confusion which has been seen on the front pages of some of the newspapers.